much to discuss today on the show with you. There's a lot that's happening in the nation with COVID-19. Just starting off this interview, I have to ask you, we're both located in New York City where COVID-19 currently is somewhat contained. My first question to you has to be, are we currently safe with COVID-19 in the state of New York or in the state of New Jersey or the tri-state area? What is your personal take on it?
Right. So, we still don't have a vaccine ready for everybody or an extremely reliable treatment. So I wouldn't use the word safe, but the good news is the cases are down. And I think that's a result of us being very, very careful. So it's not a good idea to stop being careful. The city luckily has kept the cases low. But the problem is, I know at least a few weeks ago in New Jersey, the cases already started climbing up a lot because of indoor events, indoor parties. So we still have to be very careful because the virus isn't gone. We just have gotten ahead of it.
Would you recommend people to do some activities outside in New York City or just the state of New York? Restaurants have opened up, salons have opened up, there's outdoor dining that's happening. What are your personal recommendations on that?
Yeah, outside is definitely safer than inside, especially because ventilation is a big issue, especially with the spread. We know that it spreads faster in enclosed spaces. So being outside is good, but you still need to be spaced out. So if you're outside and in a big crowd, it's not very good either. So you want to wear a mask, you want to stay far apart. It's good for the outdoor dining and supporting the restaurants, but make sure that restaurant is following social distancing and appropriate measures, because I know some are and some aren't.
Definitely. Let's get into talking about the states that are surging with cases right now. I'm looking at California, Florida, Texas. They have all surpassed the number of cases we saw in New York. And the South, Midwest, and West are currently filled with cases. Do you think this spike is the reason of reopening too fast or just an increased testing?
No, I think it definitely is reopening too fast, because the rate of the cases are far exceeding the rate of new tests. So if both were increasing at the same time, I'd say, okay, maybe it's the testing, but it's not the case. There's definitely more cases than tests being done, in terms of frequency and volume. The other thing is a lot of the states open before the curve was going downward. A flat curve does not mean zero cases. It just means that the cases are continuous and not going up. You want a downward sloping curve before you can even consider a reopening. So downward means it's going to zero. So New York followed that. They waited 14 days for cases to decrease, deaths to decrease, hospitals to open up before they even thought about opening up. But a lot of other states didn't do that.
Do you think some of these states have to shut down? And also just talking about these states that are surging, what are the states that you're most concerned about?
Yeah, so some of the hot spots are, Texas, Florida, Arizona. We've seen a big surge in California as well. But you probably know from Governor Cuomo's travel list, more and more states are ending up on the list of people who have to quarantine. I think it's over 31 or 33 states now. So, many places are seeing a rise. Even New Zealand, who had no cases for 100 days, they're starting to see cases again too. So again, I would not use the word safe or that we're out of the woods.
Yes, for sure. What is your biggest concern as a medical professional right now?
My biggest concern is the cases staying low and not increasing before we are able to come up with an effective vaccine or a good treatment. So that's my biggest concern, that we keep things as is and we don't slide backwards to how it was in March and April, when we had 800 deaths a day in New York. It was a big loss.
Yes, for sure. Just talking a little bit more into the vaccine, I know you have been very
Mhm.
involved in the entire process of these vaccine trials. I wanted to know what kind of information you could share with us at this point on ITV Gold. We're hearing so much on this race for vaccine between countries, between different pharmaceutical companies. What is going to create an effective vaccine that is, workable next year?
Right. So the good news is multiple companies have shown in their initial phases that the vaccine is effective. It's also safe, but we don't know how long that immunity will last. So we know it works, at least now in the short term, and we'll be following those patients to see how long it lasts. And now many of those companies have moved to phase 3, which is the last step before FDA approval. And that's when they'll test 30,000 people minimum, just to make sure it is safe, it is effective, and test all different groups, high risk groups as well. So hopefully, we continue to get good news and it works at the large scale too. But the key will be how long it will work for.
And how long do you think it'll take them to determine that? And in
I mean,
terms of,
we're hoping by the end of the year. This development is happening at a much faster rate than ever seen before. Normally, a vaccine takes at least a couple years, and that's on the optimistic side to develop. This is the first time we're moving this fast from phase 1 to 2 to 3. But the good news is, since so many companies are involved, if we have multiple effective vaccines, that'll be great because then there will be more supply for everybody.
in terms of looking at these pharmaceutical companies, could you give us an insight into how many companies are involved, or which are the main ones that are currently involved in these vaccine trials?
Yeah, so I don't know the exact number, but I believe there's at least 10, probably more, of companies around the world working on vaccines. At least here in the US, both Moderna as well as Pfizer has moved into their phase 3 testing, which is the last step before the FDA approval. It's anticipated that AstraZeneca may soon follow because they're already doing phase 3 in other countries. So hopefully that will be coming soon. But, they each have different technologies. So both Pfizer and Moderna are both mRNA vaccines. And then Oxford is a little bit different. It's an adenovector virus. So what that means is each of these have different ways of creating that immunity in the body. Yeah. And then, as you may have heard, Russia recently announced they have a vaccine, but there's a concern if they did all the phases appropriately.
When do you think we'll get more information on that?
Um, about Russia or
Well, Russia, yes.
the other? Yeah, I'm not sure. It's hard if the country themselves isn't forthcoming with it. So, for example, with a lot of the studies with other companies, they publish their results so
Right.
everybody could see them, and other scientists not involved could critique it, just to make sure it's accurate and fair, and all the appropriate things were done.
Right.
But we haven't seen anything published from there, so we don't know. And also, it might be that they only tested in a small group, which also doesn't help. You really need to test in thousands of people to make sure it's truly effective and
What
safe.
What about updates on therapeutics? I know last time we discussed remdesivir being given to critically ill patients. I'm still
Right.
again hearing about hydrochloroquine as well in the news. Just wanted to get your comments and updates on that.
Right. So remdesivir, we have good studies in very sick patients that it helps them if they're in the hospital, critically ill. we don't have good studies in those people who get sick outside of the hospital and who are recovering at home. So it'll be interesting to see. Also, a steroid called dexamethasone also has been shown to be very effective in those sick hospitalized patients. And as for hydroxychloroquine, so far we actually haven't seen good information, both in the hospital or out of the hospital. So until we have a better study, it's hard to know if it's really helpful or not. And then outside of that, there's some monoclonal antibodies being made. So this helps also prevent COVID, and it also treats it. So basically, there's some companies that are making antibodies using partly from recovered patients, but then some that they make that on their own, which could also be a promising treatment. They also have just moved into phase 3 of testing.
Oh, wow. So there's a lot that's happening in terms of these therapeutics. And
Right.
it seems like some of that is actually working out, at least for the critically ill patients. Only time will tell
Yes.
what's happening with the rest. I want to take this part of the interview and talk to you about children. Last time also we had discussed about that the allergy syndrome that we have seen in children, but just recently
Right.
it was announced about 100,000 children have been tested positive for coronavirus. There is indication, of spread of the virus amongst children. We have schools reopening, which is such a major issue. I would love to get your comments on how we should look at children's health right now, and how should we look at reopenings of school.
Right. So, it's concerning because nobody really knows what's going to happen. We initially thought children were immune or safe from getting the virus, but we're learning that's not true. They're in much better shape than adults, but there are still kids that get very sick. There's been deaths of children too, as recently as a week ago in Florida, of teenagers and then even younger children. So, it's still a lot we don't know. So once we move towards reopening schools, we have to be very careful because we don't want to, again, rush and reopen things and then harm children potentially. But the good news is so far they are in a better boat than the adults. But the problem is they can still bring the virus home and make their parents sick or their grandparents sick or the teachers that they interact with.
Right. I really want to get your comment on this. If a parent is right now deciding if they want to send their child back to school, what do they need to determine? And also, we're looking at New York State also opening schools, according to Governor Cuomo. What are your comments on that as well?
Right. So, I tell parents, because I get this question a lot, it depends where you live, like the region, and how many cases are in that region. Because I would give different advice to someone in Texas versus New York right now, but then it might change. So if you're in a place where there's a lot of cases and it's surging, I would think twice about sending them back. I would first start out virtual if possible. But if you're in a place with very low cases, then I would see what the school is doing to keep people safe. Are they keeping kids far apart? Are they making them wear masks? Are they, keeping them in cohorts? So a lot of schools are keeping like kids in small groups so they don't interact with a lot of people.
Right.
And then finally, I'd probably want to know, what other measures are doing. Are they only having them 2 days a week versus 5? So all of those things are important. And if a school's not doing those things, you may want to consider, keeping them home, or if they live with somebody who has a high risk condition, that's another thought.
Yeah, definitely. How important does wearing a mask then become? And I want to address this question because, we are talking about universal mask mandate that many health experts are actually suggesting. We are sending children back to school. I would just like for you to address the importance of that.
Right. So the mask is extremely important. because they found that face coverings can reduce spread by almost 70%. Especially if you're indoors, like we mentioned, there's not good ventilation. The mask is a barrier between two people. So I think absolutely the mask mandate is needed, especially in schools. A lot of the countries that were able to get rid of the cases quickly had mask mandates.
Yes. You know, you have talked to us before about policy and politics and the importance of that in the healthcare system. My question to you would just be, what are you expecting out of the system right now? What is still missing? And do you still see disparity amongst minority communities when you're looking at the COVID-19 cases?
Right. So minorities, unfortunately, have huge disparities, not just for COVID, but for every chronic condition, and much of it is access to care, access to affordable housing, food, medication. So living in areas that are more crowded, so all of those groups are much higher risk of COVID-19, and probably because they all have the risk factors for COVID-19, like diabetes, obesity, hypertension, heart disease, all of those things already, those disparities were there. And then you add a new medical problem, it makes the disparities much worse. And policy and politics is important, but unfortunately, this shouldn't be a political issue. It should be just a clear scientific issue.
Yeah, for sure. What is needed from the government at this point, Dr. Parikh?
I think the government needs to put in some strict measures so everybody is on the same page. A lot of the surging we're seeing now is from states all acting on their own, which I understand that every state is different, but there has to be some universality, whether it's a mask mandate or strict requirements for reopening. So yeah, if your state is ready, by all means. But the problem is nobody's on the same page.
Yeah, that is so true. And I think it's so important for all of us to get on the same page. Just the last question to you. What are you focusing on for the next 4 weeks?
So for the next 4 weeks, I want to see what comes out of these phase 3 vaccine results. It'll be too soon for results, but, people are being enrolled, so that's exciting. And, with this illness, you learn something new every day. And so I'm sure things will change a lot in 4 weeks. And, we'll have hopefully more information, good information. And I hope cases stay down in New York, and they go down in the other hotspots as well.
Yes, for sure. Well, thank you so much for being with us here on ITV Gold. It's always great having you, and we look forward to having you again, maybe after the next 4 weeks. I hope you're staying well.
Thank you so much.